Well, hello, everyone. Today we're speaking with Dr. Thomas Wyatt, who is a surgery resident at Texas Tech in Lubbock, Texas. And Dr. Wyatt wrote a really interesting, intriguing piece in the August 2021 Bulletin of the American College of Surgeons, which is the RAS Bulletin, really understanding advocacy and its importance with regards to firearm violence and associated mitigation of that violence. So, Dr. Wyatt, how did you pick this topic as your area of focus as you're going to discuss advocacy?
When my group and I first met, we were brainstorming about the many roles that surgeons have in their community. And we were trying to approach from a public health standpoint and tackling, big issues. And especially in this day and age, firearm violence has been increasing. There's been an increased number of mass shootings, and seems like, every day we hear about firearm violence. And so, what really is the role that surgeons have, not only in treating patients, but also in preventing recidivism, or, working at the community level to try to prevent this from happening in the first place. So yeah, that's how we got started.
Yeah, and certainly, I think you recognize how important of an issue it is. Can you outline for us how big of a problem firearm violence is in our society?
Yeah, I mean, and I know that in 3 out of every 10 firearm related injuries are reported to be assaultive type injuries, and unfortunately 6 out of 10 are self-harm related. And so, this there were a number of studies that we came across that, especially among, in the recent couple of years, there's been an increase in active shooting events. I know that the FBI has publicly available data on that. And so it is a major issue. And I think there's a lot of underpinnings that we tried to tackle. And, it's not just a political issue, it's a healthcare issue. These are people with families that are affected by this. So
Sure. I really like how you and your authors wrote one particular phrase with regards to firearm violence and the issues surrounding it. You wrote that research and advocacy is complex and multifaceted with regards to firearm injury and violence research. So what did you mean by that? Complex and multifaceted. I think it's probably very accurate.
yeah.
What were you trying to point out?
I think we were trying to talk about, some of the back and forth dialogue that happens at the governmental level, and especially in regards to even looking up some of there was one thing that we had read about a certain amendment called Dickey's Amendment, that for years it was not even feasible to receive money for performing research on firearm injuries. And this was, related to lobbying. And so it's very complex from that standpoint. But also when you look at the actual, again, the underpinnings of firearm violence, there's a lot of different socioeconomic factors, psychological factors. And so I know we've talked about articles in our lit review where, they broke down what happens at the family level, what happens at the individual level, the community level, the resources available to people who feel like they need to engage in that violence. And so a very multifaceted topic.
Yeah, it sounds incredibly complex, and sometimes when we see such a complex situation, it's easy to kind of throw up your hands and say, well, there's not much that can be done because of how complex it is. But obviously, the American College of Surgeons has had a pretty large role in trying to address some of these issues. Can you outline a little bit of what you described as the role of the college with regards to firearm violence and trying to mitigate it?
Yeah, absolutely. And, when we were reading it, I mean, it started with the creation of, organized trauma centers where we can deal with individuals who are affected with firearm violence, and that makes places available, or that creates resources um, for individuals, but also, there's been a lot of lobbying power to try to promote, background checks, more enhanced background checks, limiting the use of certain types of firearms. And, again, we wanted to keep it as a focus of, you know, um, how we can intervene as surgeons, and this is something that we see every day. So
Sure. I think you pointed out a facet of this, which is actually really important, which is the state trauma systems that are funded at the state level to make sure that there are robust places where complex traumas can go, and that traumas are appropriately triaged so that the more complex cases go to these level one or occasionally level two trauma centers. And certainly the American College of Surgeons is quite involved in the verification of these trauma centers as well, to make sure that base standards are met and that there's a constant effort at quality improvement. One of the quality improvement programs that you mentioned in your article, which I think would be worth describing a little bit further, is TQIP. Can you tell us a little bit about TQIP and how that's
yeah.
used for quality improvement?
Yeah, so TQIP was derived from NISQIP, sort of inspired by that, and I think some of the variables included in that database are more appropriate for trauma patients, and not only for predicting outcomes, but also um, identifying roles for improvement in our care. Um, so I know that you know, over I think over 400 institutions have been submitting data to TQIP, and so it's just one of many sources that we can use to uh, look at the state of the state of the art in trauma management, um, and how we can constantly refine ourselves.
Sure. Another area that I think would be useful to point out is EMTALA, which
Yeah.
was a really important rule, essentially, to ensure that patients get to the places where they need to without barriers. And you really spoke quite a bit in the article you and your authors did about access. So could you tell us a little bit of what EMTALA does and how it affects patient access?
Yeah. So if I if my research serves me well, then EMTALA was passed in the mid '80s, I believe, and it was designed so that it stands for the Emergency Medical Treatment and Active Labor Act. And so anybody who's physiologically unstable or they're in active labor must receive care at or be stabilized at an emergency department, regardless of their ability to pay. Um, and so, I think that this is highly important for at least as a starting point, to provide care for all individuals, regardless of their current financial status.
Sure. And I think the other facet of it, and you kind of alluded to this, we talk about trauma systems and centers, is that centers who have further capabilities will have to accept those patients as
Mhm.
well,
Mhm.
so they can get to the appropriate level of care regardless of their ability to pay. I think that that's certainly an important part of the access that you noted in your manuscript for sure. Um, Another important point I thought, which really struck me when I was reading the manuscript, was about how important the social determinants of care are that you mentioned already as we were speaking, and in particular, the importance of surgeons and individuals who care for these individuals who may have been hurt, to then also work to decrease the amount of gun violence. And the particular area where I thought was really striking and important, perhaps for us to talk a little bit more about, was gaining the trust of the communities where some of this violence may happen, so that we come up with a plan to help reduce the overall level of violence. So, could you tell us a little bit more about this strategies to build that trust, and kind of the importance of that?
I know that, when we were reading about our these social determinants and some of the trust, I know that especially I came across that one phrase that was, distrust in law enforcement and sort of viewing law enforcement as a type of enemy. I'm not so sure that I don't know how surgeons can join up or link up with law enforcement, or if, through hospital violence intervention programs, perhaps we could work with victims of gun violence. But I know that that could be one idea to start to build that trust. With regard to those intervention programs, there's been some mixed data as regarding their implementation. I think the latest that there was a meta-analysis done on a number of different studies that unfortunately looked at a number of different parameters, and it was sort of hard to compare them from a cost standpoint too. But there is I think that there is a significant role for the adaptation of more violence intervention programs, and whether that's um, keeping in touch with a victim of gun violence, uh, and celebrating the fact that they're alive today, and trying to help them regain their footing in society after such a tragedy. I mean, I think those sort of seemingly small individual level steps can have a giant community impact.
Sure. No, I think that trying to prevent violence before it happens certainly would be preferential. I'm a surgical oncologist, so prevention of cancer for me and prevention of violence both kind of resonate in the same way, I guess you can say.
Absolutely.
Well, so one reality, of course, for all of us, but perhaps surgeons more than others, maybe surgical residents more than any of us, is that our time is limited. There's all these other responsibilities that you have. As a resident, of course, you're a learner as well, and you want to get all the knowledge you possibly can prior to going into practice independently. And in practicing surgeons, similarly, have the responsibility of caring for patients, and that is a tremendous amount of time as well. So advocacy is really hard from a time perspective. So, what advice would you give someone who is interested in injury violence, injury violence prevention, or gun violence prevention in advocacy? What would you encourage them to do as something they could do, even though they have significant constraints on their time?
That's a great question. I think that for me, great work is accomplished through great teams. And so getting in touch with individuals like your attendings, junior faculty, senior faculty, even individuals at the, in say the Department of Surgery who aren't surgeons, who may be involved in, say, establishing registries or quality improvement. And I think that if you bring those ideas of, hey, I want to try to make a difference in the community somehow, if you have an idea, generally there's a lot of excited people who want to help you with that idea. And so I would say don't let the time constraint be a limiting factor, because we're all busy, and I know that we all have to take time for ourselves and our own development. But don't hide the idea. Bring it up to people and see what can come of it. And I think just pursue that. Try to brainstorm with those teams and see if if an article would be helpful, if some sort of an initiative would be helpful, or start an initiative and then track that over time, I think would be um, that would help put those systems in place to make big changes.
Sure. Your manuscript had a lot of really great points. I know that we covered a few of them. Any points that we didn't cover that you wanted to highlight further?
One thing I do want to talk about is, in our manuscript, we talked about the survivors of firearm injuries and how these individuals can experience high rates of PTSD, depression, long-term pain, disability. And so, as a from a system standpoint, our work isn't done as surgeons once we stop the bleeding. Our work is done, once those individuals are rehabilitated and become productive members of society again, or can get back to their daily, their lives. um, that brings me the most joy, to see those patients, um, and come out of what is the darkest, time in their life, and become get back with their families, get back to their jobs. um, that's the ultimate goal. That's why we do this.
Fantastic. Well, thank you again, Dr. Wyatt, for your time and a really well-written manuscript. A lot of great insights with regards to gun violence prevention, and its interface with advocacy. So thank you very much for your time.
Thank you, Dr. Mammen.